Welcome back to the Dr. K Call. Today we're going to talk about the surgical option of partial knee replacement. Now, most of us, as we age, we have environmental injuries, we have genetics, we have um, our jobs, we have things that happen over our lifetime, and we end up with arthritis in our joints. And partial knees are an option for those people that are bone on bone in just one compartment. So those are the people that are very bowed or very knock-kneed that have wear in just one compartment. Now, not everybody's a candidate for partial knees, but a lot of people are candidates for partial knees. So what a partial knee does is it just replaces the worn area of your knee, and it keeps your ligaments and it keeps the rest of your knee. And the idea is to uh, change it back to the pre-disease state. In other words, to put you back to where you to your alignment that you were in when you were 25. So if you were bowed when you were 25 with a partial knee, you're still going to be bowed because it's using the ligaments to balance your knee. So the advantages of the partial knee is it feels more like your own. You function in general at a higher level, and it's a lot less risk in terms of the risks of anesthetic, infection, blood clots, even death are about 50% of what a total knee is. It's also outpatient. It's been that way for the last 10 years. And so it's very common. I've been doing these at our outpatient facility for the last 8 years and sending everybody home an hour after surgery. So it's a very common outpatient procedure. Now you want somebody that does a lot of these because many surgeons don't do partial knees, and total knee is not a wrong answer by any means. It's just a more aggressive way, and you can end up with a knee that is good, but it generally doesn't function quite like a partial knee, and it doesn't feel quite like your own knee as a partial knee can. So I think that if you are a candidate for partial knee, partial knees are a good option for you. Now, a lot of my patients want to know, so if I have a partial knee, will I need a total knee? If you look at the data and look at statistics, 90% of the partial knees are still functioning at 10 years and 80% are still functioning at 20 years. So the likelihood of needing a revision is there, but it's not high. Certainly, partial knees are revised more than total knees because you can revise a partial knee to a total knee. Once you have a total knee, you've kind of burned the bridges, and you really don't have another option other than a revision total knee, which is a big deal. So for young people, I encourage a partial knee. For elderly, I encourage a partial knee as long as you're a candidate. And to determine if you're a candidate, you need to come in, see your orthopedic surgeon, have some stress x-rays, and ask the question about a partial knee. Now, you want to make sure that your surgeon does partial knees. Some surgeons don't do partial knees, and that's okay. A total knee, again, is not a wrong answer, but you want a surgeon who does at least one partial knee a month. I teach the course on partial knees, and I encourage people at the course that if you don't do at least one partial knee a month, you really probably shouldn't be doing these because you don't do enough to get really good at it. So, partial knees are a great option for a lot of people out there. It's 50% of my knee practice is partial knees, and I encourage it. Thank you, and we're going to talk about total knees next time.